Welcome to the very first episode of Red Threads. This is a student led podcast created to raise awareness about blood cancers through conversations with healthcare professionals, patients, and advocates. We are a group of HOSA students interested in healthcare and public health. And through this podcast, we hope to learn directly from experts while sharing important information with our community. Hello, my name is Veda and I'm your host. Today I'm joined by my co hosts.
Hi, my name is Till.
And I'm Avani.
For our first episode, we are honored to be joined by Dr. Nilay Shah, a hematologist and medical oncologist with Atrium Health Levine Cancer Institute in Charlotte, North Carolina. Dr. Shah specializes in the diagnosis and treatment of blood disorders and cancers, including leukemia and lymphoma. We are incredibly grateful to have Dr. Shah as the first guest on Red Threads. Dr. Shah, thank you so much for joining us today. And before you get started, can you please tell us a little bit more about yourself?
Yeah, of course. Thank you for having me. So I am, like you said, I'm a hematologist and oncologist here at Levine Cancer Institute in Charlotte. I think it's now Advocate Health, Atrium Health, Wake Forest Baptist. But I finished my medical school in 2007, went on to do internal medicine, and then subsequently did training in hematology, oncology, and then even stem cell transplant. And so I spend most of my time here in Charlotte doing or providing care for patients with malignant blood disorders, so leukemias or leukemia-like disorders, and then doing stem cell transplants for those patients. And so that's what I do.
Okay, and for listeners who may not be familiar, how would you explain what blood cancer is in a clear way?
Sure. I think blood cancers are a little more difficult to explain than a solid oncology kind of diagnosis. So, and I think people have talked about this before, but you can imagine in your mind what a lung cancer looks like, or a brain cancer, or a prostate cancer, or breast cancer, et cetera. But it's hard to wrap your mind around what a blood cancer looks like. So blood cancers are disorders of any part of the blood system, whether it's the white blood cells, immune system, whether it's the red blood cells, whether it's the platelets, or it's a combination of some or all of them. Most of these blood products are created in your bone marrow, and or your lymph nodes. And anytime something goes awry, whether it's a production problem, a maturation problem, they tend to create bad forms or clones of themselves, and that in its essence is what a cancer is. And so any cancer of the of the blood system, the lymphatic tissue system, the antibodies, et cetera, we call those blood cancers. And that ranges from something like leukemia, lymphoma, myeloma, and all the different variants that come with that.
Thank you. With that being said, how are blood cancers typically diagnosed?
Sure. Like most cancers, blood cancers can be diagnosed in a variety of ways. But it all, I think, comes down back to two real processes. One is you're symptomatic, whether you've lost some weight, you've altered your appetite unintentionally, fatigue, bleeding, bruising, um, pain, etc. Something takes you to your primary doctor in emergency care to get it checked out. Um, and that in turn eventually leads to a diagnosis. Or there are a variety of these, blood malignancies that don't necessarily present with symptoms. You go in for routine visits feeling like yourself, and somebody does a routine blood test or routine imaging or anything, and it's an incidental finding, but that needs to be further worked up and eventually leads to a diagnosis. So I'd tell you that most of the cancers do end up with symptoms that lead to a further workup, but there are patients who have incidental findings. And then the tricky part for those patients are trying to figure out what to do. Yes, you have a cancer. Yes, you have a diagnosis, but you feel good. Am I going to do anything that actually helps you feel better, or am I just treating you to treat you? And so that presents a different type of challenge.
All right, thank you so much for breaking that down. The next question we have is, what are some early signs or symptoms of blood cancers that people commonly overlook?
Sure. Blood cancers as a whole is a wide spectrum of disorders. And so I don't know that it's a one size fits all. I think in general, a common phrase that we use for all these disorders is called constitutional symptoms. So that encompasses things like unintentional weight loss, like did you lose 10% of your body weight not trying? Somebody who says they started working out last month and lost 32 pounds, that's probably not realistic. So there's probably something extra there. So weight loss unintentionally, um, increasing fatigue, night sweats. So, and generally we say drenching night sweats. So you've got to change your clothes, change your sheets even several times a week because you've just kind of sweat through them. Again, not something that you would expect with even things like colds or flu or things like that. So, and I'm missing one. Fevers of unexplained etiology. So yeah, I've been running a fever every night. They tend to happen in the evenings for some reason. 101, 102. I've been checked out by my primary care. I went to an urgent care. No evidence of any viral infection. Antibiotics didn't fix it. So I think those are kind of common to all of these. But then each individual disorder is going to have its own specific type of symptoms. So if you have a lymphoma, for example, you might have swollen nodes in your neck or armpit or groin. You might not be able to feel them, but you've got pain in those areas that leads to a workup because of the increased size of a lymph node. If you've got multiple myeloma, you could present with bone pain that actually is a fracture of some kind, a fractured back that you didn't realize. And if you got leukemia, bruising, bleeding, could be symptoms of those too. But I think what we tell most people is, and not that, I mean, we tell them after the fact, but I think the common scenario is if something doesn't seem right, it's okay to get it checked out.
Thank you. And building on top of symptoms, how do you think that blood cancers affect patients and families beyond just the physical symptoms that you just talked about?
Sure. Good question. I think it takes a lot of people and a lot of support for a patient to get through this. For the individual who is diagnosed and going through it, yes, there are obviously the physical symptoms that we just talked about, plus everything that comes with the treatment, whether it's chemotherapy, immunotherapy, plus or minus, cell therapy like a stem cell transplant or CAR T treatments. There's obviously going to be physical impact to that person, from the diagnosis itself to the treatments and then to the recovery process. But I think what we fail to always discuss is what else comes with it. For the individual and the person going through it, what's the emotional tax? How does it affect your ability to kind of get up and stay motivated, to keep fighting through the physical limitations, the financial burden that can come with this? What insurance is great and they cover quite a bit, but they don't cover everything. And unfortunately, our drugs aren't on the cheaper side of things. So even if you're paying 5 or 10 or 20%, that can still add up. How do we make sure that we provide support to help you bridge that gap? And then for the family members, it's extremely, I think, unnerving and difficult for a family member to watch a loved one go through something like this. It's a very helpless feeling. And so what can we do to try to provide support for them? In terms of information, education, but also provide means to help them help the individual going through it. I think caregiver responsibilities take quite a toll. And so the more caregivers and more support you have around you, I think the easier it is to get somebody through this. But I think it's a big impact on the patient, but also their family and their loved ones. It really is hard to get somebody through this. I think the common phrase is it takes a village. Well, it applies here.
As we talk about support, how do you see awareness playing a role in improving outcomes for patients?
Sure. I think that's a good question. Awareness for anything, right? Like whether it's in all aspects of life is a boon. The more you know, the more you can help, the more you can be prepared. I think awareness in terms of helping a patient get through this it really falls on the providers. It's trying to be aware of what the patient's support system, socioeconomic kind of status is, so that we don't allow those pitfalls to happen. So I think from a provider standpoint, it's important for us to be aware of not just the patient and their diagnosis, but what is surrounding them, as we just discussed how important it is to help somebody get through it. I think from a family standpoint, or a support, system, the more aware they are of what to expect. Hey, these are going to be bad days. We should expect bad days. These should be good days. If they're not, we know something's wrong. We should call. This is where our need is going to be. I'm going to have to take some time off. I think it's this big group effort of trying to make sure everyone's on the same page. Um, and so when you ask me about awareness, that's what I would think about is kind of just making sure that everyone's up to date and aware of what the true expectations are, good or bad. Um, I think if you're talking about pre-diagnosis and awareness, I think the more you know about what to look for with abnormalities related to possible blood cancers or blood disorders, the less likely you are to wait for something bad to happen. The more likely you are to go get it checked out because, hey, I heard somewhere if I'm bruising and bleeding or losing weight unintentionally or these night sweats aren't normal, maybe you get checked out and get something detected sooner than later. And so I think awareness is this big, broad word that can mean pre-diagnosis, during diagnosis, after diagnosis. It's a good question. I don't have a great answer.
All right, thank you so much for that. Since awareness play a big role, what are some ways students and community members can help raise awareness or support people affected by blood cancer?
Yeah, I think just talking about it. I think again we go back to solid cancers, breast cancers, lung cancers, colon cancers. They're everywhere, and I'm glad. There's screenings for these type of things, mammograms, colonoscopies. Um, Now and CT scans for patients who qualify because of long history of smoking. I think these words and these terms and these disorders are pretty well known to most of the public, but blood cancers are not. Right? You don't hear a lot of people talking about leukemia or multiple myeloma or lymphoma, um, and they're just as common, and they're equally as aggressive and they're equally as important to catch early and treat and all these things. And so I think just spreading the word that there are disorders sometimes that are silent. There are disorders that we can't see but do exist. And there are symptoms that make you want to go get checked out sooner than later. Yes, you're tired, and yes, you've got 100 reasons to explain why you're tired, but maybe one of them is something's actually wrong. Um, and so I think just bringing awareness to the disorders themselves, the terminology, the idea that those things exist may help save countless numbers of people because they go get things checked out beforehand. Hey, I'm losing weight, I'm coughing, my x-ray was negative. Well, it doesn't mean that you don't have, just because you don't have lung cancer, it's not something else. And so it's important to get these things checked out. It doesn't mean you have to panic. It doesn't mean that every small thing has to turn into something big. But I think if you bring awareness to it and understand what symptoms are, some people may get checked out sooner than later.
Thank you. And our next question is, how do you think that blood cancers are overlooked? Meaning, like, what kind of misconceptions do you see with like blood cancer?
Sure. Again, I don't know that they're, well, I think overlooked is a good word. I think going back to the prior conversation we just had is that they're just not as well known, not just to the community, but even to, I tell you that even providers aren't always as familiar with the blood disorders as they are with these solid cancers. Again, it's easier to get some cancers picked up because you can pick them up on a scan, right? Hey, they said they didn't feel well. We got an X-ray. We found a mass. There's the starts of your workup and your diagnosis. All too often, I see patients in the clinic who have a diagnosis of leukemia, but it was delayed 4 and 5 and 6 weeks because somebody said, well, it's probably just a cold or it's just something else, and let's treat it with an antibiotic. And reality was that their symptoms were stemming from the early onset of some sort of blood disorder. Um, and so I think even from a provider standpoint, I think if people are more aware of it and know what to look for, maybe there's earlier detection. Maybe it doesn't change anything, but maybe somebody doesn't spend their 4 and 6 weeks spinning their wheels wondering why something's not working, why they feel crappy, why nobody's giving them answers. So I think it all kind of stems back to the same thing: is that these disorders, these words, these phrases, these cancers, they're just not as common, and so they're not as well known, and so we don't always go looking for them.
Makes a lot of sense. Thank you. And this concludes our episode. Thank you, Dr. Shah, for taking the time to speak with us and for
Yeah,
helping
of course.
educate our listeners about blood cancers. We truly appreciate you being a part of our first episode.
No, thank you for having me. I think you guys are doing a great job, and I think from a leukemia provider, any awareness you bring to blood cancers, but cancers in general, is a blessing to all. So thank you guys for doing this.